Good morning. I'm here to welcome you today to the Focused Ultrasound Glioblastoma Workshop. The workshop is sponsored by the Focused Ultrasound Foundation, and that workshop is co-sponsored by the Society for Neuro-oncology and the American Association of Neurological Surgeons and Congress of Neurological Surgeons Tumor Section. If we can go to our slides. So the workshop has really been the work of a broad steering committee and also the help of Dr. LeBlanc and Dr. Pavlichuk. The idea of this workshop really came out of discussions with the Focused Ultrasound Foundation and the emerging indications for focused ultrasound in the space of neurosurgical and neuro-oncological practices. Next slide. If we think about paradigm shifts that have occurred in neurosurgery, one of those was the early application of microscopy for resection of tumors. It's hard for me to understand resection of tumors pre-use of the operative microscope, but obviously it was commonplace prior to use of high-resolution, highly magnified optics that we commonly use in the OR today. Neuroendoscopy has also been a paradigm shift. Stereotactic radiosurgery, something near and dear to my heart, including the gamma knife, has been in many ways disruptive shift and a paradigm shift in technology that has changed the way we treat patients with neurosurgical problems, complex brain tumors, and other types of disorders. And of course, the advent of CT and then MRI has really changed the way neurosurgeons practice. In the space of neuro-oncology, obviously the advent of multiple different adjuvant therapies, targeted therapies, immunotherapies, molecular classification of brain tumors, and even more recently, tumor treatment fields have really been paradigm shifts in the way that we manage patients with brain tumors. Next slide. As we think about focused ultrasound and MRI-guided focused ultrasound specifically has been a paradigm shift for the management of essential tremor and tremor-predominant Parkinson's disease. Some of the work done here at the University of Virginia has helped to lead the way with that. And the real question that we hope to answer, or at least to get to some preliminary answers, is will focused ultrasound be a paradigm shift for glioblastomas and other types of brain tumors, much as it's been for essential tremor and for tremor-predominant Parkinson's disease, as well as lots of other extracranial applications. Next slide. So this is a 2-day workshop, and I will not be able to encompass in these couple slides the entirety of the workshop. We have a cast of really luminary individuals who are helping to participate in this, leaders in the field in neuro-oncology, in neurosurgery, and focused ultrasound applications, both preclinical, early laboratory-based, as well as clinical trials. Day 1 will focus on different types of mechanisms: blood-brain barrier disruption, ablation, lithotripsy, synodynamic therapy, radiosensitization, and gene and cell therapy. There are a whole host of mechanisms by which we can use focused ultrasound to treat brain tumors, and these are just 6 predominant mechanisms that we'll explore in the workshop today. Day 2 is really going to be focused on the questions shown here, burning questions that we hope will shed some light on where really the thought leaders in the field believe are important questions that need to be answered, and how we go about answering those. Also, really what patients might be best suited for focused ultrasound clinical trials, and then eventual application. And then how do we monitor patients that have been treated with focused ultrasound? Do we monitor them with imaging? How do we monitor with liquid biopsies? And can we use MRI-guided focused ultrasound to actually facilitate the delivery of liquid biopsies? Finally, we'll talk about clinical trial design, the regulatory approval process. Some individuals from the FDA will join us, and then reimbursement, which is essential to making this a viable treatment option for patients, not just in North America, but throughout the world. Next slide. One of the famous German physicist, Max Planck, said, and to paraphrase him, he said that science advances one funeral at a time. More precisely, what he wrote was, a new scientific truth does not triumph by convincing its opponents and making them see that the light, but rather because its opponents eventually die and a new generation grows up that is familiar with it. My hope and expectation, and the hope of the Focused Ultrasound Foundation, as well as I can speak for the AANS CNS Tumor Section, will be that we can advance the field in a meaningful way, bringing thought leaders who are already involved in other aspects of neurosurgery and neuro-oncology for the management of brain tumors to embrace focused ultrasound, and then to bring up a whole new group of leaders that can help to advance the field. Let's avoid the funerals, let's advance the science, and I'm hopeful that this workshop will do that today. Thank you.